And contraception is largely considered a private matter, but the country is witnessing more and more teenagers involved in sex. But it's not all gloom, as Kenya has experienced gains from increased use of modern family planning methods. Our health reporter, Sharon Momanyi, sheds more light on this.
Compelling statistics by the Center for the Study of Adolescence indicates that 4 out of 10 Kenyan girls had sex by the age of 19 years. In fact, many by the age of 12. Is it time now to talk about contraceptives for teenagers? Ann Mitu is one such girl.
So I got pregnant at 19. I got my son. After 1 year, my parents were really angry about it. So I had to go and live with my baby daddy. And then after 1 year, he passed away. So I had to struggle a lot with hustle.
Anne, who is now 24, says that she adores her son, but wishes that she had knowledge of contraception much earlier.
In Africa, there's a lot of stigma behind girls who get pregnant at an earlier age, which comes with the fact that parents don't like talking to their children about sexual education. They leave it for the teachers leave it for the pastors and all that. So at the end of the day, this topic, nobody actually talks about it.
Teenage pregnancies is just one of the various sexual and reproductive health and rights issues at the center of global discussions. And on this day, high-level representatives, including Melinda Gates, UNFPA's Babatunde Osotimehin, and Health CS Cleopa Mailu, are at Kangemi in Nairobi to address the state of family planning in Kenya.
You have heard about sexual education, which has been controversial, still from the same quarters the other reporters mentioned. We must give information to the young girls to make choices.
Let's use social media to reach young people. Let's provide them information through social media. It liberalizes the space.
If a girl or a woman has the chance to space the births of her children, to voluntarily space them, and do healthy timing and spacing of births, she unlocks the cycle of poverty for herself and for her family.
I meet Moses and Evelyn Kengere, a couple who, after having 3 sets of twins, decided to take up family planning.
Nikamwambia, ukiona mwezi ikifika karibu, tafuta dawa. Akitafuta dawa, pills inafanya roho inapika, blood pressure inapanda juu kabisa mpaka inamsumbua. Okay, ikafika wakati hapana. So tujaribu shindani ya miezi 3. Ikawa mgongo inamuuma ama ogeni yake ipotee kwa miezi 3 na ikirudi inarudi kwa miezi 3 non-stop.
Moses would then undergo a permanent vasectomy, a method not so popular in the country, but one the couple says unlocked more happiness for them.
So yule sasa rafiki ama ile wase tunakaanga naye, naeleza hiyo facility ni mzuri, na kabla hujafanya ongea na mama, sababu yeye ndio receiver. Umwambie tu nitapaki hivyo as active as I am.
Now, in 2012, Kenya joined the rest of the world in committing to an ambitious goal that by the year 2020, 120 million more women and girls from developing nations would have access to contraceptives. Now, Kenya has made tremendous steps in achieving this goal. Kenya had specifically committed to increase the number of women and couples using contraceptives from 46% to 56% by 2015. It surpassed this target by reaching a 58% access last year. In 2015 alone, the use of modern contraceptives averted 1,246,000 unintended pregnancies and prevented 4,000 maternal deaths in Kenya.
If women have access to contraceptives, we just literally meeting the goals that we've set with the London Family Planning Summit, we can bring down maternal deaths by 30% and newborn deaths down by half.
There are initiatives such as Tupange, a campaign by a consortium of NGOs that seek to improve quality and accessibility of family planning services. PMA 2020 is also one that uses mobile devices to gather national data on family planning as it monitors gains towards the 2020 goals. Sharon Momanyi, KTN News.